record on this computer. We're live.
Hi, welcome. Good morning, good afternoon, good evening, good night, depending on where you are in the world. I'm Laura Janusik, and I'm representing the International Listening Association in the third of our fourth webinar in our webinar series for 2017. Joining me today are Irene Gottgens and Corine Jansen, who are the co-founders of the Narrative Health Network in the Netherlands, and they're going to present today and help us learn more about narrative healthcare and close listening. Welcome, Corine and Irene. How are you?
Hi, Laura.
Thank you.
We are very excited, Laura.
Tell me why.
Well, it's our first webinar, and we never presented anything about narrative healthcare in this way and to an audience of so many countries.
That is extremely exciting, a great way to get your word out there, no doubt about it. So tell us a little bit about what narrative healthcare is.
Well, there is a lot to tell about narrative healthcare, and we made a little presentation. Maybe you allow us to start?
Do you want to have a short check-in before we start?
Yeah, we can check in too.
Yeah. Maybe it's possible, because I have no idea who is in the room right now. But Laura, is it possible if we have a short check-in with the people who are joining us at the moment?
Sure, I think we can do that. Let me see who I have. We have, of course, Phil Turpak, our executive genius when it comes to the Zoom platform, among other things. We have a lot of names that I can't pronounce, but I will have fun trying. We have Bettine Ploet.
Hello, welcome, Bettine.
Thank you.
Maybe you can, in a very short sentence, your name, where you're from, and what you made to join us today.
Yes, I'm Bettine Ploet from the Netherlands. And at the moment I work at a program called Patient Participation in eHealth. And I hope to stimulate lots of dialogues on the role of patients in our healthcare system, and see how we can have patients participate in the development of eHealth technologies, and also create eHealth technologies that help patients to have a better life in the end, and also have a better conversation with their healthcare professional and the other people that are important in their life.
Okay, fantastic. Thank you.
And then next I see Annemiek Vroom.
Annemiek.
Ahoy. Good evening. My name is Annemiek Vroom. I'm from the Netherlands. And I'm the director of the ICON Foundation. We build bridges between the patient perspective and the healthcare sector. And I'm in this webinar because I am very fond of the work of Corine and Irene. So I would love to join.
Good to see
you.
And we have Isa Vels. I think Isa is coming in on telephone, so I'm not, she says, I am not able to speak during this webinar, no microphone, but I am a care ethicist, and she can hear us too.
Great, welcome to have you.
And then next it looks like Helen, and I'm assuming that's Helen Ralston?
Yes, it's Helen Ralston. Body similar to show you my face today, but I'm listening with great interest. I'm delighted we're having this webinar coming from the Netherlands. We've got such a big international audience, so I'm delighted to be participating. Thank you for doing it.
Thank you for joining, Helen.
I see someone by the name of Inga, but I don't see a last name.
Oh yes, my name is Inge Wijsman. I hope you can understand me because I don't know if my microphone is doing well.
Yes, we can hear you.
Okay, I'm Inge Wijsman. I'm Belgian, but I live in the Netherlands, and I am from origin. I'm an editor journalist, and I've also did a course of storytelling. And I myself had diabetes type 2. And by getting another lifestyle and by taking healthy food and a lot of sports, I turned it around. So I don't have diabetes anymore, and I want to use storytelling to move people to do the same thing. And I was attracted by narrative healthcare and close listening because I think listening to people is very important, and then to co-create a story so that people recognize their own lives in that story and they can change behavior. Because diabetes is not in the direct way something you pass on to each other, but people, they live in regions, and they eat the same things, and so I think it's very important that we tell other stories to our neighborhood and our children, so that diabetes won't grow an epidemic like it's becoming now.
Thank you, Inge. Thank you for joining us.
We have Carol Benton, and I just got a chat from her. She says, I don't have a microphone, but I'm listening to the webinar today. Thank you. And I can tell you that Carol is a professor here in Missouri in the USA. Great. And then we have Mark Wong, and I see Mark's microphone is muted. Mark, would you like to say hello?
Mark, where are you?
No mic.
Oh, Mike, yes, he says no mic, sorry as well.
Okay.
So I think at this point, those are the participants that I see.
Well, some people are very technically equipped to listen today. Only to listen.
Absolutely, absolutely.
All right.
Okay. Shall I start, Laura?
You shall. Thank you, Corine.
Thank you so much, dear. Irene and I will try to explain a little bit about narrative healthcare and close listening. We want to be this very interactive meeting, so we just have some slides to get you some feeling about what we are doing and what we believe in, and afterwards you can ask all kinds of questions to make things clear, and maybe we can do some exercise too. Okay?
Perfect.
Well, first let us introduce ourselves. Irene?
Yes, I can introduce myself. So my name is Irene Gottgens in Dutch, a soft G, which I heard is very hard to pronounce in the US. Co-founder of Narrative Healthcare Network, and I'm currently working on my PhD research on narrative and design in healthcare, and specifically in a project where I'm currently designing a new healthcare model for elderly people who are affected by cancer. And I do that at the Radboud University in Nijmegen in the Netherlands.
Okay, and for the people who don't know me, my name is Corine Jansen in Dutch, Corine Jansen in English. I'm the other founder of the Narrative Healthcare Network. I'm board member of the International Listening Association, and a lot of you came to join us in Nijmegen in 2014 to have our first healthcare and listening conference over there. And I work with Irene on the Narrative Healthcare Network, and therefore also I am a keynote speaker and trainer too. I worked in Radboud University Hospital too, and now I'm busy with all these kind of stuff, and I like it a lot. Okay, who of you had never heard from the word narrative healthcare? Laura?
Until I met you, I had never heard that term.
Okay, but the other ones did. Okay. Well, let me take you to the century of my dad. There were a lot of people lying in hospital together, and the physician was coming along to ask, how are you doing? And well, when I was a child at the age of 5, I was lying like this in the hospital too, with 20 children. We had a little surgery, and everything the doctor told us was right. We wouldn't doubt anything he would tell us. And there was no technique, there was only conversation, if the physician would listen. But in this period of time, everything was about physicians. They were very powerful, they were very clever, and as my father said, if the doctor says you have to take this pill, you did it. You never wondered if it was wrong, you didn't doubt it, you just do what the doctor told us. But now, this is a new generation. The generation when children can, well, they can swipe earlier than they can read. So, well, it's not the same like this picture, but they are very familiar with getting information, searching for things, and this will be the new time zone with big data, with a lot of artificial intelligence, and that means that healthcare will change because we will have artificial intelligence who can find out about our genetic problems, about our diseases, but also about the pills who are needed for us to take to feel better. So the role of a physician, the role of a nurse will change, in our belief, to a person who will coach, who will guide you dealing with your illness. And how do you do that? Well, if you go back in history, we see Descartes. And I think in every country, people know Descartes. And Descartes' idea of the body was being totally independent of the mind. So there was a shift, your head, and there was a body. And there is a vast difference between the mind and the body. And in that body, the body is always divisible, while the mind is completely indivisible. That was the quote of Descartes in 1694, so in the 7th century. And the strange thing is that nowadays it is still the basic of our healthcare system. And we are changing, but we are changing slowly, but still Descartes' idea is very important in our healthcare system. And then we have another thing, and that's the Flexner report. And it was introduced in the United States. Maybe you've heard from that, Laura. And it was written in 1910. Did you know it, Laura?
I did not know this. I'm feeling really bad, but I'm also learning, which I love. So thank you.
Well,
we have a response from Mark 1, and he responds with, I think, therefore I am, I listen, therefore you are.
Thank you so much, Mark. Thank you so much, Mark. Yeah, Mark is a wonderful guy in listening. Well, the Flexner report was written in 1910, and as I wrote down, it transformed the nature and process of medical education in America with the resulting elimination of proprietary schools and the establishments of the biomedical model as the gold standard of medical training. Well, what's written over there is that we, today, in the whole wide world, have education, medical education, based on the Flexner report of 1910. So every student going to study for medicine is still going, is having education because of this report from 1910.
Corine, can I ask you a question?
Yeah.
First of all, certainly I can understand that we wouldn't want to necessarily have a model of particularly something like medicine that began in 1910, because there have been just so many advances in science since then. But I'm curious, I keep on looking at Descartes' quote, and I'm struggling to understand exactly what is meant by the divisible and the indivisible. Can you help me understand that?
How shall we explain this? Because we can do a webinar about this quote for all our.
Well, there is a little story about that, how he came to say this, and that was Descartes was really interested in how the human body and people work, and the moment that he laid someone on a table and actually cut him open, he started to studying like what do we people exist of, and everything that he could see, he could touch was there, and he was in this he was in search for something that is called the soul, or something that is called the mind, or where is that thing located in the body? Well, it's not located anywhere in the body. I can't touch it, I can't feel it, I have this person right in front of me, I don't know where it is. And that's the moment when Descartes said that is not part of a human being. It might be there, but I'm not including it.
Did you hear it, Laura?
I did. Thank you, Irene. That's a great story, and that really sums it up. Thank you.
And also to how they build upon that in the Flexner report, and there are really good short summaries of the Flexner reports for anyone who would like to read those. It has brought us immensely a lot. It is where our specialization knowledge in the West all cultivated from. So one of the reasons why we became so incredibly good in the medicine that we have in the Western countries today is because of the Flexner report, is because they stimulated the specialization of the very particular study of organs and of the human body on very specific levels. So let's not forget, it's not a bad thing. It actually created the basis for our highly, highly developed knowledge of the human body that we have at this moment.
I think it's important. We use and we study a lot the history of healthcare, because Irene and I believe that if we want to change the healthcare for the future, we have to understand the history. And for us, Descartes and the Flexner report are very important historical issues to understand why we are here today with the education and the views and the vision we have on the human body. And the idea of Descartes is now maybe old-fashioned, but it helps us a lot at that time. And that is the same thing with Flexner report. No one in 1910 could imagine what would happen to our society where we are today. So it was very helpful, and it's still very helpful. So what Irene just said is really important, and we are not want to throw it away. We just want you to understand where we come from, because that is necessary to understand where we are going to. Okay?
That makes sense. Thank you.
Okay. Well, and then we have the narrative practice. I just told that we believe that the role of the physician will change, but also the education will change, but also we all are changing. And all of us will be or are patients in one way or another way. So it's all about us, and we are human beings. So a narrative practice, and we call it a narrative practice because it's not a model, it's not a system, it's a practice you have to practice so many times and to talk about a lot of things and try to incorporate in your life, because it's not something you just can do. You have to make a choice if you want to create connection with people from these skills on. So it's a choice, as listening for me is a choice. But a narrative practice within healthcare promotes creativity, reflection, and skilled attention. I think, Laura, you can call it empathic listening in some way, close listening, not just listening to a story, but what is this person trying to tell me? What do I understand? What are my assumptions? And that is so important to know. So you are your own instrument, and therefore you need to know yourself to use the narrative skills and use it for narrative practice.
Bettina asks here, how do we need to understand the word critical here? As in paying attention to the power of relations or the deconstruction? How do we mean the word critical?
I think, Bettina, when we use the word critical and so skilled attention, it's making yourself ready to be there for the other person. So most of our physicians need to do a lot of administration, and a lot of patients are still going to a hospital, to a physician, and find it very difficult to prepare themselves. And then when they are together, they have to meet each other because they are within this healthcare process together. It's the physician, it's the patient, and maybe another caregiver. So critical means that you try to understand, what does this person means to me? How do I evaluate this person? What is my assumption about the disease this person has? What is my judgment about how this person is talking about his disease? So it is really the highest form of seeing, feeling, reading, and listening to another person. Is this? Can I make it clear like this, Irene, or do you want to say something more?
If I would have it say that the shortest way, you could also use a sharp attention.
Yeah. It's about being there. Yeah. It's really about being there. Is that clear enough for you, Bettine? I can't hear Bettine.
No, we are in the chat.
Oh, you're in the chat. Okay. Yeah, we continue. Irene and I believe that care arises and takes place in the encounter between people. In Dutch, because there are a lot of people from the Netherlands, we call it de ontmoeting. Een echte ontmoeting. And when you are really connected, and that doesn't mean a lot of time, connection can take place in a few seconds, then can care arises. That's the most important part for us when it comes about narrative healthcare. Okay?
The connection is the most important part too, yeah, when it comes to narrative healthcare.
Yeah, because when you feel connected, then there will be respect, and then there will be trust, and there will be honesty. And then you talk about listening and about a real dialogue. Yeah? Okay.
Mm-hmm. I think maybe to add to that, because we had a lot of discussions about that, why not call it a meeting? We call it an encounter.
Yeah, we call it an encounter.
Yes. So because the encounter really has that connection component to it. We have a lot of discussions about words. So Bettina, we really like your questions like this and using words.
It's maybe it's nice to tell you all. We started this society in December, but we already started our conversations and discussions about words in 2015, because I think we talked about the word gezondheid, healthcare, for a whole weekend. Yeah. And we were just talking and talking and talking because we want to understand each other. And therefore, it was very necessary to listen to each other. Do we talk about the same definition as you feel? And what is a patient? What is a healthcare? And we just had a meeting before we started this webinar. And we were talking and talking. And there was another person joining us. And she says, is this what you're doing? Yes, this is what we're doing, because this is a narrative practice. It's not, okay, you told me this and I understand. And that's why we call it a practice, because when Irene and I talk to each other online or in real life, we are always searching for meaning of the other person. What do you want to tell me? From what perspective? And then, well, this slide is on. All beliefs are a matter of perspective. Irene and I have, we truly believe there is no, how do you call it? There isn't a truth. Mm-hmm. It's all perspective. And when you are choosing, when you choose for really close listening, you try to understand the perspective of another person. And when you are going to your physician, or your physician will meet you at home or otherwise, it's important to understand we all have another perspective. And then you will get to the narrative practice and the narrative skill. And I will explain. So
I'm sorry, Corine, before you go, I don't know if you could just give me a 30-second synopsis of probably a conversation that the two of you have had for hours and hours, but I'm still struggling with this idea that the term encounter includes almost an intimacy component that the word meeting doesn't. And perhaps it's language difference here, but can you help me understand how you came to that conclusion?
Yeah. Well, let me explain it from the listening part, Laura.
The interesting thing here is also the English and Dutch language.
Yeah.
Mm-hmm.
Yeah. But let's try to explain. When we talk, Laura, about empathic listening, we agree that the other person is the most important of the dialogue at that moment. We choose to listen to that other person. If we are in a meeting, you can have different kinds of listening. But this encounter means truly be there and truly try to understand, because you can never understand, but try to understand. And therefore, you need intimacy. And just figure out, when you are visiting your doctor, it's almost always about very intimate things, because it's about you and it's about your body, and you're very vulnerable and maybe very scary. And therefore we choose the Dutch word ontmoeting and the English word encounter, because a meeting can be very interesting, but not in the true connection as we meant it. Is that a little bit clear?
It's clearer. I will say it is definitely clearer, so I do appreciate that.
Okay. Thank you. Okay.
I have a remark from Bettine. Oh,
let me unmute myself. I think that's better for the sound. Perhaps it's interesting for you to explore the concept of soft self-other differentiation.
I'm sorry.
Perhaps it's interesting for you to explore the concept of soft self-other differentiation. Interesting concept.
Okay. Can you explain why you wrote this, Bettine?
I've done a lot of research and lots of stuff on the theme of dialogue, which is really also close to the topic of listening, of course. And there I came across on the term soft self-other differentiation, and that term really helped me to catch the feeling of close listening, and also it links to the idea that when you are really listening and really reflecting on yourself and other, then it becomes sometimes possible to the separation between the self and other can disappear, and that makes it possible to create a form of transformation of the self, of the other, through the relationship. And I think it's a lovely concept to talk about the power also of the close listening.
Yeah, very interesting.
Hear what I'm saying?
Yeah. Does it also relate to the I-thou perspective of Martin Buber? I'm not sure.
Yeah.
It sounds familiar in that sense. Yeah.
Beautiful.
Okay, nice. Thank you.
And I also have a question from Isa Vels. She asks if we are familiar with presence theory from Andries Baerts.
Yeah.
Yes.
Yeah, we do. Yeah, we do. I think the people from the United States are not familiar with that. But that will change, Laura. Next year in Dublin, we will talk about that.
Terrific. I was going to say, if I have to represent the United States, I can say I'm not familiar with it. Phil, are you familiar with it? Presence theory?
Not as a theory. I understand. I understand what you're saying, Corine, and I love the point of encounter as well. So I think that I have come into an encounter with some of these terms, but not as a particular theory itself.
Okay. Yeah. Okay. Well, on the next slides, you see a very important sentence for Irene and I. A dialogue broadens your perspective, which can lead to the encounter. It doesn't necessarily will, but it can lead if you choose. And I think that's important about close listening. You can always choose, but you can always choose to stop. And we found that people find it very difficult to say, I just want to quit here because it's hurting me, or it's taking me to places or times I don't want to remember of. And this is important, because if a person wants to stop listening, you have to try to understand their perspective, why. And that's perspective is so important in narrative healthcare. Maybe the most important skill, maybe the most important thing. Yeah.
I see a remark from Philip, and he says, I already see so many connections that can and will share in my business and professional communication students. I'm very curious, Phil.
Tell me.
Yes. The differences here between encounter and meeting, because we focus in on meetings, but meetings sometimes there are a whole bunch of people there and they're doing many different things. And when you have an encounter, as you explained it, Corine, there's that connection, there's that understanding, and it could help to solve big problems.
Yeah.
Oh, okay. Maybe I have a way to say it, but maybe I don't. So you tell me. But bodies attend meetings, but minds attend encounters.
Oh, I'm gonna write that one down.
Can you just repeat it?
Bodies attend meetings and minds attend encounters.
Yeah, it's wonderful, Laura. This is wonderful. Yeah.
And Mark says encounter with hearts too.
Yeah.
Oh, yeah.
Yeah. Yeah. Well, we are starting to get through the narrative, because we try to create a concept of narrative, and we are getting closer. Because Irene and I truly believe that if you want to make yourself available to the other, you have to recognize the self. And recognizing the self was for me the hardest part to become a certified listening professional. Because you're confronted with all your filters, with all your memories, with all your assumptions. And when I was confronted with myself, although I thought I knew myself, I noticed what a kind of bad listener I was, because I brought so much of myself into the conversation. And when I learned in that year how to recognize the self, and so my assumptions and my judgments and my filters, the world was open. The world was open. And then I started learning, truly learning, not just what I wanted to hear, but just what I want. No, what the other person was telling me, and what I was trying to understand. So it made my world a bigger place and gave me so much more perspectives than ever before. So this is important because, well, later on we will come with the quote of Emmanuel Levinas, another philosopher, and he is talking about the other in a very specific way. So you have to recognize the self. Well, I think you all know this beautiful picture. Mark will know because, well, it's made in Asia. And this is what we use in narrative healthcare. The hearing, the thinking, to be present, to see, to focus, and to feel. And when Mark just said, encounter with the heart, it's to feel. So when we talk about narrative healthcare, Irene and I choose to use the words, use all your senses. All your senses, your smell, your look, well, everything you can use your sentence for. Because if you use them, you will get the most information you need to have a good dialogue and have a good conversation and to be in that encounter. Okay? Well, when we were studying, because we do a lot of study to get where we are today, and well, we choose narrative healthcare because we want to be a lifelong student. We believe we can learn every day, every moment, not only from each other, but from every person we will meet and every person we will encounter in our lives. And when we were reading, we started with Seneca. I think it was in 2015 when we started with Seneca, I thought, Irene. Yeah, it was 2015. We started to have narrative, how do you call it? Narrative beraad?
Narrative deliberation.
Narrative deliberation about the letters Seneca sent to Lucilius. And Seneca is a Stoic philosopher. He was a Stoic philosopher. And he wrote a lot about anger. And we wrote a lot of him. And we had a lot of deliberations about him. But this year, we really meet Emmanuel Levinas for the first time. I think so, Irene. Yeah. We had his book. It's a very, very difficult book. It's called in Dutch Totaliteit. Totality, I don't know how you, the word in English. It's called Totaliteit. And Levinas has a quote, and we put it on this beautiful picture. The pictures we use are from a South African painter, and she is living in the Netherlands. And she wouldn't explain to me the meaning of this painting, but for me, it had to be with the quote of Emmanuel Levinas. And it's not you who gives the world a place, but it's the other who appeals to you, appeals and gives you a place. Does any one of you are familiar with Levinas?
Oh, I feel so bad. I am not, but I know that your compatriots will be.
You
Well,
really,
Asa is.
yeah. Levinas, I think, Laura, well, I think he's a very difficult philosopher to understand because, well, this afternoon, Irene and I was still talking about what is the appeal? When does an other person appeals to you? What does it mean? Because it's another word than a request. It's not a request. It's really an appeal. And we both were trained by Jan Tij, and he is very familiar with Levinas, and he did his PhD about Levinas. And when I talked to him in May this year, he said to me, Corine, while I was doing my PhD, I still couldn't answer the question, when does an other is an other appealing to me? What does it mean? And I'm still searching, I'm still learning. And well, this afternoon, Irene and I were talking about what is an appeal, what is a request, and when do you know it is an appeal? And can you choose to not deal with this appeal? Can you choose not to give an action to the appeal the other person is doing on you? And I think that's sometimes the same when it comes to listening, because people don't always ask, will you listen to me? But they are also doing an appeal. And then you can make a choice to answer that appeal, although they didn't do a request. Is it a little bit clear?
Yes.
Yeah?
Get that.
Okay. When we talk about narrative practice, we talk about learning from art, history, philosophy, literature, learning from the study of humanities. It all started at Columbia University. Rita Sharon started it, I think 15 years ago, isn't it? Yeah, 15 or 20 years ago, maybe.
Maybe she formalized it then, but...
Well, she formalized it. It started much earlier, but she gave the words narrative medicine, I think 15 or 20 years ago. And now, 2017, we see more physicians are talking about hearing, seeing, feeling, about empathy, about compassion. Because narrative healthcare is not the same as storytelling in healthcare. It is creating more perspectives through the study of humanities. And therefore, it is something different than storytelling. And Adriana Boise is a physician, and I think she wrote beautiful quotes. It's through hearing, seeing that story that we connect with the person, especially if their journey reflects pieces of our own. I can't read it further. I have the photos on it.
The narrative allows us to connect not simply with the facts of the case, but the emotion that drives both.
And I think it's important to look at that story and how to learn about your own emotions, because that is very important in narrative healthcare. When I started as a certified listening professional, I was getting stories from people, and they told me stories about their lives. So they shared their story. But the most important part started after the conversation, because then the physician got the story and says, okay, if this is the life of my patient, and if this is the perspective on quality of life, we have to make choices and have conversation about, do you want to keep the quality of life or do you choose for quantity of life? What about using medicine or not using medicine? So it's the story is just the first part to create more perspective on the person who is sitting behind you or in front of you.
I want to say something about that. I think that I have a different. I'm sorry, my English is not that good. I have learned something different about storytelling, and that's exactly what you're pointing at, that it's not only the story, it's not only telling the story, but the fact that the stories come together and they touch somebody else, and then they co-create together with what happens a new story. And that's what storytelling is about. So I think what you mean by narrative, sorry, help me, healthcare.
Narrative practice in this way, yeah.
Narrative practice. I feel it is almost the same as what I mean by storytelling. It's not only telling a story to somebody, but it is after that what happens with that story and how does it affect another person, and what are the actions that are taken in the future by telling that story. And that's the complete thing of storytelling, and that's what storytelling is about. But I admit that a lot of people in Holland and maybe in the rest of the world see storytelling as only telling stories. I want to take out of the world this misunderstanding, because real professional storytelling is about this.
Yeah, and I don't think there is a right or wrong in this.
No.
But we just want to say it is a different part. I think, but maybe it's also the same in that we use the study of humanities to create more perspectives and to use the critical attention, the close listening, and the creativity. But therefore, we use the study of humanities. So we use a lot of literature, poetry, paintings, but also music, to learn ourselves what kind of perspectives and filters and assumption we have.
Okay.
And I think that's a little bit more than storytelling, because it's about the self.
Yes.
So
that's another dimension, I would say.
Yeah.
Yes. Yeah. I would say until now I have pointed the art of storytelling as I practice it to create a change of behavior. I would call it a 3D storytelling. But now I see this, and I am listening to what you're telling me, and I think this could be a 4D storytelling.
And how would you call the force of the D?
It's about the creativity, and I think it's exactly why I was drawn to this webinar, because it's maybe something I miss in my profession. Because I am a very creative person too, and I want to take all the arts I know to put them together, so it can be very complete.
Yeah.
Well, so maybe I know I'm at the right place now.
Well, you're welcome.
It's not becoming the 4Ds of making it 4 times more difficult, but adding 4
Well,
my smile is getting broader and broader.
I see, you're growing in your chair. It's fantastic.
Well, it is nice. When I was on a holiday, I read the book, all the letters from Vincent van Gogh, you all know him, to his brother Theo. And Irene and I are now talking with a neurologist about 5 paintings. There are 5 paintings of Vincent where you can see his illness in his paintings. And we used the letters he wrote to his brother Theo. And then you talk about the narrative system, because we have the art of the painting, we have the letters he wrote, and we have the disease he has. Mm-hmm. So then everything is coming together. And but it's also when we give training, we use a lot of poetry, and that poetry is not about healthcare; it's about life, and it's about human being, and what we have to deal with in life as a human being. And when we talk with physicians,
isn't that all art?
It's all art.
Isn't all art doing that?
Yeah. That's why we talk about human-centered care and not about patient-central. Although it's okay to use it, but we use the word human-centered care because as a physician, you have to take care of yourself and know yourself to use the narrative practice, and also taking care for your patient, but also the patients. It's very helpful if you as a patient know yourself in your own illness, but also in your life. Mm-hmm. So, okay, that's nice. Thank you. Can we go on? Yeah?
Yeah.
Okay. We want, I'm sorry. We want to show you a video. I think it's nice to show that. Yes. And this video is called Please See Me. And it represents everything. So just take a look.
Here, in a hospital, in your office,
in my office,
where I am your patient,
where I have many patients.
I came here today for a checkup, to check in with the hope you can help me feel better.
I come here every day to make people feel better, for checkups, to check in with the nurses and patients I care.
I'm afraid of what you might find. Afraid you may not find an answer.
It is my job to find answers. I went to school for much of my life in order to care for yours. It is my job.
We are here in a hospital, in your office,
in my office,
where I am your patient,
where I have many patients.
I am more than my cells, more than my chart can tell. I have a wife and children, 4 grandchildren. Please see me.
I have a family too, people I care for. I'm here to care for you.
The hospital is large, full of people waiting for their sickness to be named. Do you remember my name?
Yes, I remember you, though often I am tired. I leave for work too early and get home too late. I have a long list of patients to see and not enough hours in the day. I'm not a god.
Please see me. Everyone hurries here. I'm afraid to ask a question, or I forget my question and then you are gone. I need to know what might be wrong.
Please talk to me. I want to have the answers. I studied years for this. I learned the names of every bone and muscle, of diseases and how to treat them.
I am not a doctor. The names of pills and procedures sound foreign to me. But this is my body. What will this medicine do to me? How much do I owe per pill, per minute of your time? Please see me.
I read your chart, your family history, but I need your help to understand what paper cannot tell.
Please help me. I want to be healthy, but I need to know that I can trust you.
Please don't be afraid. Talk honestly to me.
I am here. I am your patient.
You are my patient.
Please listen to my story carefully. Carefully.
I want to hear your story, to care for you.
Help me understand. Give me the tools I need to be healthy.
To help you stay healthy.
To be a partner in my care.
To be a partner in your care.
Please see me. I am your patient.
You are my patient.
I am here with you, a patient.
A doctor.
A person in your office.
In the hospital.
We are working to get better.
To be better.
We are working, patient and doctor together. Please see me.
Okay.
Laura, I'm seeing Sheila. Hi, Sheila. Hi, dear. Laura.
Yes.
Yes, you are still there. We can do a small exercise right now, or just start with some questions and answers.
Well, let's see if there's some questions first.
Yeah.
I see, Corine, just to let you know, we're at an hour now.
Okay.
So I don't know if you want to take a 5-minute break and then come back and do Q&A and the exercise, or if you would prefer a different agenda.
What do you think, I think that maybe it would be good to introduce a little exercise. Yeah, okay. Yeah. You just introduce the exercise and let's see what's happening over here, okay?
Is there anyone in desperate need of a break?
I am.
You are, okay. Well, very good. I mean, if no one says something. Shall we then take it? Is a 5-minute break okay?
It's okay. It's okay.
Okay, let's take a 5-minute break and then we'll introduce a little exercise that can help you train with narrative skills.
Thank you.
That's
All right,
perfect.
see you, bye.
Phil, welcome. I'm Laura Janusik from the International Listening Association, and this is the second half of our third webinar this year. It is September 2017, and the topic is narrative healthcare and close listening. And we're joined by Corine Jansen and Irene Gottgens. Welcome, and I'm turning it back over to you two.
Fantastic, thank you, Laura. So what we wanted to finish this webinar with today is to offer you a little tool to practice with, because a narrative practice is a practice, which means it's a lifestyle. You have to do it over and over and over again to train yourself also in developing these competencies. And it's sort of like an awareness practice. Like any creative practice, it's not something that I can give you a tool and if you just apply it, then I say, now you're being narrative or now you're listening good. So it's not a magic tool we're offering you, but it's a fun tool. And one of the more beautiful ways in which you can cultivate your narrative skills is by writing. Because what writing does, it really forces you to stand still in the moment, to listen to yourself, and put words into an experience. And what that does is it's literally to help you create perspective. So reading and writing are beautiful ways to develop your narrative skills. And I think, Laura, you asked before this webinar if everyone would take paper and pencil with them. So
I did not, but we can certainly ask that they do that now.
I hope you have. Can everyone make sure you get 1 minute to get paper and pencil? Because I'm going to give you a little writing exercise. No worries, Corine. All right, so there are several ways how you can encounter something that we call close reading. And close reading is actually paying very critical, skilled attention to a situation that is in front of you. And close reading is actually a technique that is from literature studies. So literature scholars use close reading to actually, well, what Corine and I already talked about, when we have very deep discussions about words that Levinas uses in his text. Why does he choose to use this particular word in this particular sentence? What kind of meaning does this have? That is called close reading. And I want to give you a little writing prompt also because we want to invite your own creative skills into this. And we've chosen this picture for it. And this is a picture from Candace. I have actually no idea what the title of this picture is. Did she tell us?
No,
she didn't tell us. She didn't tell us anything, right? Well, that's actually perfect. And one thing that was a remark that was made a little bit earlier that was about the difference between the meeting and the encounter. and that the encounter is very much essential for true listening and for, well, what we call a true connection in healthcare. So the writing prompt I want to give you by looking at this painting is write about an encounter. So the writing prompt I'm giving you is write about an encounter. You can use inspiration from the painting if you want to, but I'm going to give you 3 minutes. Laura, can you be the timekeeper in that?
I certainly can.
I'm going to give you 3 minutes in free writing, which means you're free to write anything as an answer to this writing prompt, what you want. Write about an encounter. Set the time, put the pencil to the paper, and let it write for 3 minutes. Do not judge anything that you put on the paper. Just write. Do not think, just write. That's a very important rule. Yes, Bettine, you want to ask?
Oh, Bettine, your microphone is off. Can you send that question in chat, perhaps? At the bottom of the screen?
Oh, you're unmuted.
Oh, there you go.
What's your question, Bettine?
What we need to free write about?
The writing prompt is write about an encounter.
An encounter, okay.
Yes, in Dutch it's schrijf over een ontmoeting.
Yes, okay.
And especially since the discussion we had a little bit earlier on about the difference between a meeting and an encounter, take that information in. We're going to start the clock. And remember, do not judge anything you put on that paper. Just write for 3 minutes straight on. Doesn't matter if it makes any sense, just write it down. Are you guys ready?
We're ready.
Okay.
And go.
And go, 3 minutes.
And that is 3 minutes.
So who had a hard time not judging? It's difficult, right? So what I want to do next is invite, you don't have to, but one or two of you to share what it is that you wrote down in those 3 minutes. And before you raise your hands, maybe you can already let yourself be known in the chat box if you're the one who wants to share. For those who are listening, I want to invite you to listen to the shape in which the story is written. So listen to the voice that is used. Is it used, written in the first person, or is it written in the second person, or in the third person? What kind of mood or emotion is it written in? What kind of scene is used? Is it dramatic? Is it poetic? Is it plain, or is it really a storyline? And what kind of time is it written? Is it written in the past? Is it written in the future? So those are elements to listen to the shape. Why I give you that assignment is because we don't want to judge the content of someone's story. We want to judge, and we want to have a critical attention to the shape in which the story is being told. So after one of you is willing to share his or her story, I would like to invite two people who could give a little perspective on what it is that they heard. So who would like to read out loud?
Sheila, yeah.
So I see Sheila is writing a message. But Laura, you wanted to share?
No, I wanted to say that Sheila had said she wanted to share or offered to share.
In the chat, right?
I just saw Sheila on the screen too.
Do you want me to just read all of what it's not very much, but.
Exactly. So this, do not pre-frame.
I'm sorry, do not what?
Do not pre-frame. So we have a tendency sometimes when we do some free writing, is before we share it with someone, is what I was trying to write is this, or it might not make any sense for pre-framing. Just write, just read whatever it is.
Okay. So I met Ralph Nichols in 1984. Ralph is considered the father of listening, and I was so taken with his listening skills. I remember calling my mother later and telling her that I had met Ralph Nichols and how he made me feel that what I was saying was significant and brilliant and interesting. Then it occurred to me that he was just being a fantastic listener. I remember how it felt to be listened to in such a way, and by Ralph Nichols, the father of listening. And then I got it. That's what effective listening does for the speaker. But it also made me want to hear what he had to say and to listen to him in the same way, especially with the same respect and attention.
Can you repeat it, Sheila? Can you share it again?
Oh, could you not hear me?
I did hear you, but I'd love to hear it twice.
Oh, okay. I met Ralph Nichols in 1984. Ralph is considered the father of listening, and I was so taken with his listening skills. I remember calling my mother later and telling her that I had met him and how he made me feel that what I was saying was significant and brilliant and interesting. Then it occurred to me that he was just being a fantastic listener. I remember how it felt to be listened to in such a way, and by Ralph Nichols, the father of listening. And then I got it. I realized that that's what effective listening does for the speaker. But it also made me want to hear what he had to say and to listen to him in the same way.
Hard for you to free write this?
I can hardly hear you.
Hard to free write this?
Was it hard for me?
Yeah, Irene, I think your microphone may be off now. Because I think you might be coming through Corine's microphone.
Yes, I'm back.
Okay, there you are.
Thank you.
So my question was it hard for you to free write this?
No, because when you said to think about an encounter, that's one of the first ones that came to mind, because I was brand new to the International Listening Association. I was a graduate student, just starting to study listening, and here is this, famous person, the father of listening. I mean, he's the one that did the first study that showed that listening could be taught and that we could get better at it. And so, just to meet him was an honor, but then, to have him listen to me in that way that made me feel like, I really had something important to say was just a fabulous encounter. And he practiced everything he preached.
What the three things that I wrote down listening to your story is the word admiration. It's sort of the feeling that I get when I heard this. I wrote down 1984, as in bringing back a memory that long ago. It must have been really, really significant. So that was it. And that you called your mother to share this. So it made me very interested about the relationship that you have with her.
Well, she has also been a member of the International Listening Association. In fact, she and I have co-presented a number of times. So she knew who Ralph Nichols was. And I think, she understood why I was so excited about meeting him and, just impact. But I thought it was so funny that here, I thought that because of how he listened to me, I thought that what I was saying was, so interesting and brilliant and everything. I thought later I just went, no, he was just being a really good listener. But, it makes you feel like you're important and what you have to say is significant. And I just was so impressed with how he listened to people. He didn't know who I was. I mean, I was a nobody. He didn't know. So I didn't get any special treatment.
Thank you for sharing that. So the only thing what I'm giving her back is what I hear when I hear her story, which is also very filtered by my own perspective, of course. It probably says something about my mother as well, that I write something like that down. So is there maybe someone else who would like to give his or her perspective about what you heard Sheila say when she told what she wrote down?
I heard about her love for listening. A really passion for listening. Well, she really admires this man, and I think it's, I hear a wish and admiration about listening.
Was there something specific in what she said that triggered you in this?
It's more what I hear between the sentences. Yes, like or in the tone of voice. It's really a loving tone of voice, which brings me that feeling. Yes.
Well, this is exactly what Corine and I mean with you have to use all your senses, because then you start to listen between the lines.
Yes.
Yeah. Beautiful. Maybe one more perspective.
I was surprised by the length of what she wrote. So I think when the 3 minutes went on, she almost immediately began to write. So it must have been when you, Irene, mentioned the word write about an encounter, Ralph Nichols must have immediately popped into Sheila's mind. So I think it was very impressive. That impression never left her mind, ever. And that's because of the length of the almost letter she wrote to me. I think that's what I will remember about her story, what she told about the encounter.
Well, those are gifts for you, Sheila. Perspectives for you to receive. So what it is that we are doing right now, and you can do this to a very extended amount of time. I mean, Corine and I have narrative deliberations that take on for 2 full days. which you had last summer. So this little exercise, which we did right now, it's called a close reading of someone's text in this, at this moment, a spoken text, but you can also use a written text. You can also use a painting if you want to. And the next step is to have that narrative deliberation with 2 or 3 or as many people as you want. I would keep it as small as you can, to share what kind of perspectives are actually available in understanding what it is that we're sharing right now, whether it is looking at that painting, sharing a piece of text, looking at a piece of video. And that is training you, because I did the narrative medicine course at Columbia University, and we did a lot of these sessions, and I was continually to be surprised about what other people could see in exactly the situation that I was looking at, or what other people could read in text that I was reading as well. The fact, Inge, that you say, I think it's Inge, yes, that you were surprised about the length of text that she was able to write in 3 minutes. I was like, yeah, that's actually quite interesting. I didn't thought that at first, but when you said it, was like, she actually wrote a short story in 3 minutes. That's interesting. So what does that say about her creative skills and Sheila's use of words, that it's probably might be easy for her coming to this encounter with Rolf Nichols to come up with many words about that. So doing narrative exercises has everything to do with sharing and reflecting on perspectives. And there are many ways of doing this. This is one way of doing this, but we wanted to offer you a very practical tool to train your own narrative skills. Read a lot and talk about it a lot. That's actually what we want to give you.
And, well, that's a lifelong learning. And narrative practice is a lifelong learning. It's not a model, it's not a trick. It's just enjoying, reading, seeing, listening, and reflecting.
Does anyone have questions before we move to the end? Otherwise, Laura, it might be a moment to maybe wrap up.
Well, I actually do have one question for you, because the exercise that we just did, first of all, it reminded me of how Sheila does listen that way. And whenever I'm in her presence, I feel that awe about Sheila as well. But
Wow, thank you.
the title of this is Narrative Healthcare, and we haven't really talked about the healthcare part a lot. So if you could give us some perspectives of how narrative is used in the healthcare.
Irene, you want to give that a go?
Yeah, when we talk about narrative practice, you can use it in any situation. And Irene and I choose to use it in the healthcare world, in creating a human-centered healthcare system where we believe in. And when a physician is listening to a patient and the story of her life, of her illness, of her social context, about her work, that's important for her, it is very good to notice that you as a physician bring your own perspective to the patient, but also the patient is bringing her own references, but also her values and story with her. Using narrative healthcare for us is important to give the best healthcare suiting to the other person, because we can use organs to make a decision about using pills or medication or doing a surgery. And it's okay. But we want physicians to listen to their patients and see them as a human being, and therefore be curious to their perspectives on the quality of life. And as we are explaining about narrative practice, we are inspired by the study of humanities. And reading books, listening to music, meeting, really seeing other persons, but also eating food and just sentence what the smell is, the colors of the food, and talk about it will create and make your perspectives bigger to other persons too. So if you believe that healthcare is more about the illness and about the organs in a body, but seeing healthcare as a holistic, spiritual, and greater context of a human being, narrative practice can be very helpful for you as a physician, but also for the patient. Because if you train yourself to notice yourself in your well-being or in your illness, you can share more, you feel more responsible, you feel more involved than any system can create for you. And therefore we needed this encounter. Is this helpful, Laura?
It is very helpful, very helpful. I'm wondering if we might go to Q&A, if there are any questions out there. Anyone would like to ask Corine or Irene about their narrative healthcare practice foundation. Is it a foundation?
Yeah.
Yeah. So if anyone would like to ask about that or their practice and what they do within it. I saw a chat. Isa is writing in a language I don't understand. Irene, perhaps you could look at the chat there.
Annemiek?
Oh,
Annemiek, ja?
Ja.
Jij hebt een vraag in het Nederlands?
Nee, ik heb mijn tekstje er even ingeplakt, omdat hij het, wat net verteld werd, zo mooi symboliseert. Maar ik had het in het Nederlands geschreven. I just passed my text, but I wrote it in Dutch.
Okay.
But it was a nice example, I think, of narrative healthcare in the way that Irene wrote about in the chat above. Or Isa wrote something in English.
Yeah.
About narratives. But it's not necessary to read it now. But I thought because we're wrapping up, I sent it to you folks.
Okay. Okay, thank you.
Laura, did you get the question that I had sent in before the seminar?
I don't think oh, no, I don't.
Oh, okay.
I don't. I'm sorry. What is your question?
Well, this is Corine. I'm just wondering if you have found in your practice with this, are the health outcomes better when you use your narrative approach?
I hear a lot of other sound, so I will ask Irene if she should hear you.
Yeah, so the question is, Sheila, please correct me if I'm wrong, but the question was if we see that there are also better health outcomes if we work with the narrative practice within healthcare.
Okay. Well, Sheila, in fact, there are. And I think,
I would suspect that there would be.
One of the most famous physicians and writer in the United States about narrative medicine is Danielle Offrey. And she wrote a book about what patients say and what doctors hear. And when she visited Irene and I in the Netherlands in April, she talked a lot about the mistakes she made when she was not listening to the narrative of the patients. And what we noticed when we talked about Descartes earlier, Sheila, in the time when we were separate the body from the mind, we were not we didn't have the knowledge about the influence of the mind on the body, but also the influence of food, the influence of activity, the influence of social contact. So when you talk about the narrative and listen to the narrative of people, you will better understand why they don't use their pills, why they have bad results on their mental well-being, because all people, patients, physicians, all human beings wants to be heard and wants to be seen. And if we are heard and are seen, we already feel a little bit better, because being listened to can give us hope, can give us trust, and also give us some secure feeling about being safe. And all those emotions are very important for us, for our well-being. Although they cannot cure us, they can give us a better feeling, and a better feeling will influence our body. And maybe I can share a small story of Danielle. Danielle was telling us about a man, and he had some blood results, and every time the blood results didn't confirm with their medicine use. He had to use medicine, but blood results give wrong. And she was writing down what he had to do, what time, which pills, and why it was so important. And she was writing it down. Every 3 months, he came back, and his blood results were no good. And they give signs that he didn't use his pills in the right way. And after half year, or after a year, I'm not very sure about that, she asked him, why don't you do what I write on this paper? And he says, well, doctor, I can't read. And she says, I had to only ask him one question. Do you understand what I'm writing for you? But he didn't. She didn't. And he was ashamed about his disability. And she said, if I was more interested in him as a person, and not only as a diabetic or a person with obesity, but just as a person, I would have known his problems with bad writing and reading. And after she knew his problem, she could serve him better and give him the quality of care he needed to feel better, because then he felt understood. And that is what narrative can mean for another person. Just be interested. Irene and I organize a conference in November, and there will be a person speaking about a visit to his physician, and the physician is asking him, how do you feel? And when he told me the story, he said, I told her there are two choices. Are you really interested in how I'm feeling? Or do you want to know how it is with my leg? And she became quiet. And she says, no, tell me the first. And then he started to tell about his sister. And she says, yes, but you are ill. And he said, yeah. But the story of my sister is at this moment much bigger than my illness. So if you really want to know how I'm doing, just listen to my story of my sister. And when he shared that story, she understood the influence of his sister on his well-being. And that is the power of narrative healthcare.
That is absolutely terrific. Corine and Irene, I see that we've got a few more questions that have come in on chat. So Irene, I will go ahead and ask you two these questions so you two might be able to respond to them together. Mark Wong asked, do you focus more on doctor-patient, or do you also deal with doctor, nurse, or other medical staff?
Well, I think I'm going to take your second question along with that as well, Mark. You've also written, do you have any comments on medical staff's own needs to be heard? I think Corine has mentioned it earlier. This is why we call it human-centered, and not, it's about humans and not role-centered. So this isn't about specifically the patient-doctor relationship or the patient-nurse relationship. This is about everyone's relationship involved. And like we said before, the narrative skill, it's universal. You can apply it to anything. So it's not applied to a specific relationship or a specific role.
Bettine also asked, how do you create space for people who want to learn to listen?
That's a good question. I think to maybe follow up on an example with that, I am within my PhD program I'm currently doing, I'm working together with a integrated care team, so healthcare professionals from primary care and secondary care who are all involved in the care for elderly people who are affected by cancer. And well, Mark, also what you're saying, having comments on of medical staff having their own needs to be heard. I'm not sure how that is in other countries, but in the Netherlands we have had a very big focus on patient-centered or person-centered care, very much focused on the care for patients, which is a very important movement, making it more question-driven instead of service-driven, which is a very important movement that we are having in the Netherlands right now. But within that narrative that is happening right now, we sometimes forget that part of that encounter is the healthcare professional. We need them both, and we need to take care of them both. And that was one very important thing that is coming out of the research that I'm doing right now as well. We've created intervision meetings between this transmural or integrated care team. And we had them share, and like you did today, I give them writing prompts every month to share about their own experiences with elderly patients and how do they experience that. And they share that with each other. So we have a GP there, general practitioner, we have a surgeon there, we have an oncologist there, we have a nurse practitioner there. And they share from their own perspectives, stories from their own practice. And like we did a small narrative deliberation just now, they have a small narrative deliberation on those experiences among each other. And it's a very important tool for them. They also told me, like, this whole program is an intervention in itself to really cultivate their sensitivity for perspectives of themselves. Through which lens am I actually looking at this situation with this patient right now? And they are getting perspectives from colleagues of different disciplines on how to look, how they might look differently at this perspective. A general practitioner might ask a completely different question to the patient the surgeon is seeing at the moment. And they feel that these kind of conversations help them to take care of each other and of themselves better while we're actually building relationships among them. So sometimes I'm sort of surprised how simple the intervention is, bringing people together and share honest stories. But it sets something much more bigger than the intervention in motion. That's very interesting. Does that answer your question, Bettine, on how you say, how do you create space for people who want to learn to listen? Requirements is safety and trust. And you can only do that by building on the relationship, is repeatedly seeing each other.
And I think what's important, Bettine, is not judging. We will never judge. And we ask people, don't judge yourself. Just feel free and feel safe to share your thoughts, your emotions, your fears. And I always said to Irene, we are our own instruments. There is just one Corine and Irene team. And it's important to let people know that they are okay, but they can only take care of other people if they can take care of themselves. And that's why human-centered care is so important.
Okay, thank you.
Irene and Corine, I would love to thank you on behalf of the International Listening Association for hosting this wonderful webinar. narrative healthcare and close listening. I will be the first to say that I felt like it was an encounter as opposed to a meeting. And I thank you very much for that. And I would like to give a huge shout out to Phil Turpak, our technical director, who helped us make this seamless, as we have never done it quite in this format before. So thank you, Phil.
Maybe, Laura, if you don't mind, next year, the International Listening Association is coming to Dublin. It's in Europe. It's very nearby for all of us. Mm-hmm. And we have a special day about listening and healthcare on Wednesday, June 20. You are all very welcome to join. And Irene and I will be there too. And there will be more surprises. But please join us, take a plane and join us in Dublin to learn and especially experience more about the power between listening and healthcare.
Terrific. And before I sign off, let me ask Irene and Corine, do you have anything special planned for the International Day of Listening, which is coming up September 21st, 2017?
No. Well, Irene is in Japan, so that will be difficult because there is 7 hours difference, I think. But of course, I am part of Sheila's team on the International Day of Listening, and I will have a keynote about the importance of listening on this special day for us.
Terrific. I'm actually hosting 3 different listening cafes at my house, so I'm very excited about that. I've invited over 70 people, and so far about 30 have responded. So people just come and sit at a table, and the rule is no technology. So we not only meet with each other, but we will be having encounters with each other.
Wonderful, Laura. Wonderful.
Terrific.
I think Sheila, maybe we can give a voice to Sheila because she is the promoter of the International Day of Listening.
And here she is.
Yeah.
Sheila.
Wow. Thank you for doing that. And be sure and post that on Facebook, what you're doing, so that other people can see what you can do, you know, what can be done, and that it can be something as simple as hosting a listening cafe, because, you know, we want as many people listening on that day as we can get. So anyway, it's been fun and exciting.
Mm-hmm. Terrific. Phil, do you have anything to add before we sign off?
Well, I just want to thank Corine and Irene and everybody else who joined us during this time. It was a wonderful, wonderful time. I do have to say I learned a great deal that I can apply immediately, probably within the next 20 minutes when I head over to my class, because they're doing some encounters right now. So that's really good. But thank you so very much.
Thank you, Philip, for making this possible.
Thank you, and signing off for the International Listening Association.